We've talked on this show about the major suspensions of black kids in schools as early as kindergarten, black boys and black girls. It is a significant issue. And we've heard for years what happens when it comes to our boys and girls being diagnosed with ADHD, and teachers and administrators saying they don't know how to deal with all of these kids, what in the world is going on. So the real question is it a problem with educators, not just teachers, but also administrators and the school district, or is it the actual problem with our kids? Well, educator and school psychologist Dr. Umar says one way that schools deal with perceived bad behavior is to diagnose and medicate students for attention deficit hyperactivity disorder, or ADHD. In fact, recent studies show that there's a 70% increase of ADHD identification for black kids. Black boys are diagnosed at a higher rate than any other student. So what in the world is going on? Are our kids the problem? He joins us right now, Umar Johnson, the author of the book Psychoacademic Holocaust: Special Education and ADHD Wars Against Black Boys. Dr. Johnson, when did this really start?
ADHD as a diagnosis came to us in 1980 with the DSM-3. It was ADD. And then in 1987, they added the H. It became ADHD. And when it became ADHD, it opened up a vacuum that allowed for nearly every child to be diagnosed and prescribed medication, because previously it was just attention deficit. Once they added the word hyper, it opened up the opportunity for medication.
What I'm trying to understand is, and again, look, I'm not a doctor, whether it's psychologist, psychoanalyst, medical doctor, but a 7 or 8 year old kid being hyper, I'm just okay. Yeah. I mean, I think that's called being a 7 or 8 year old kid.
It's normal childhood behavior. There's a couple issues here, Roland. Number one, 97% of all public school teachers, charter, independent school teachers are female. Yeah. So you have to look at the female culture of the schoolhouse and how when boys cannot adjust adequately to female expectations, they are marginalized. When you look at the criteria for ADHD, losing things necessary to get your work done, not being able to pay attention, blurting out answers, having excessive energy, that's normal male child behavior. But when you come to school, you're kind of expected not to engage in traditional male types of behaviors. And if you do, you become stigmatized. And then in comes the drug companies, the manufacturers of all these popular anti-stimulant medications who pay for a lot of the teacher conferences. They're fueling the overdiagnosis. They also fund significantly the American Psychological and the American Psychiatric Association. So a lot of this is about money. It's not about treatment.
So if you're a parent out there, you're watching this and hearing this, I mean, how do you combat that when that is constantly coming at you about your child?
Education. Number one, parents need to know that in the school, we do not diagnose ADHD. ADHD is not a special education disability. Now, my doctorate is in clinical, but I'm a school psychologist. I go between both worlds. You don't diagnose ADHD in the school. So why are so many boys being put in special ed for ADHD? Because one of the special ed classifications is known as other health impairment. Mm-hmm. Because psychiatry is a branch of medicine, if you get diagnosed by the doctor with ADHD, if the parent brings the paperwork to school, they can now special educate you. And I have a big problem with that, because ADHD is not a learning disability. So why are all these boys being put in special ed? Because someone outside the school said that they have ADHD. And that evaluating psychologist, 85% of the time, never observes the child in the environment where the complaints are being made. The teacher's making the complaint, but you never go to the school to observe the child to see whether or not the complaints are legitimate. So it's secondhand information that's fueling this whole catastrophe.
Where you see in schools in terms of like when that diagnosis is made, what should you as a parent be looking for when they start going in on your kid and saying, oh, you've got ADHD?
First thing, I think parents need to tell teachers to stop. You have to sometimes remind teachers that your degree, your certification and expertise is in teaching. It is not in mental health diagnoses. It is illegal for teachers to tell parents their children have ADHD. It's not illegal to recommend that the parent look into the problem more. Right. But once you say what it is, your child has ADHD because my son has it, I think he needs medicine, you just crossed the line, because now you're operating outside your boundary of expertise, and it happens all the time. And we know boys of color are disproportionately diagnosed not only with ADHD, but the conduct disorder, oppositional defiant disorder. They're on the Ritalin, the Adderall, the Cyclone, the Metadate, and the list goes on, and no one's telling parents about the side effects.
You mentioned a gender component. Do you find the same problem when it comes to black educators?
Yes and no. We do have African-American teachers who I feel, and I'm also a former school principal, by the way, I've had African-American teachers who did struggle with classroom management skill, but by and large, I've seen that the African-American teacher, because they understand the cultural milieu of our children, are able to deal with them better than teachers of other backgrounds.
Well, I'm a mom of a 6-year-old boy, and I have noticed that in some of the comments, even when he was in an all-black environment and now that he's in a more of an independent school, some of the things have been said about attention.
What's the independent school?
You know, like I don't want to put
It's not
school
publicly
out there.
funded.
Not publicly funded. I like that.
Private school.
It's a private school, but here it's like a Sidwell is considered an independent
That's
school.
a private school.
I know.
Hey, I thought that was something new.
Whatever.
But there is a difference
There's a
between
difference.
being independent and being private.
No. When it said independent, I thought like homeschool or something. So
Oh, God, no.
Oh, gotcha. Okay.
But my question would be, what are some of the tools? So again, since he talked about homeschool, I know I don't have the patience or the ability to do that. Plus, I know I'd be harder on him, and I don't want that relationship. But what can the parents do in this regard, knowing that the environment is a different place, and what do we do at home to help them facilitate this? And how do I continue to encourage them?
Okay, number one, we got to keep something in mind. Because a lot of our boys grow up without the father at home, that masculine energy which normally provides the boundary setting, the consequences, is taken out. 85% of black boys diagnosed with the ADHD don't have their fathers in their life, which is why I've renamed ADHD Ain't No Daddy at Home Disorder. ADHD. It's not about mental health, Roland. It's about the breakdown of the black family that leaves the mother there with the responsibility of turning a boy into a man. So what are some recommendations I have for mothers raising boys on their own? Number one.
And if it's two parents.
Yes,
and
even if it's two, even if it's two, be consistent with your discipline. The biggest difference between mothers and fathers is mothers are more likely to negotiate with their children. They're more likely to give a second chance. You cannot do that, especially raising a black boy. Why?
That don't happen right here.
Right.
Ain't no
Me
negotiation.
either.
No second chance.
Me either.
Women are more likely to give a second chance because you're maternal. But you can't do that with our sons. You know why? Because when they get out into the real world, they're not given a second chance. Trayvon Martin didn't get a second chance. Eric Garner didn't get a second chance. So in your household, if your son is able to push the limits of your consequences, he's going to grow up with a mindset thinking he can get over in court, he can get over in school, he can get over in the job. We have to raise them right so they can deal with what life is going to throw at them.
We're out of time. How much? Where can folks reach you?
They can reach me, drumarjohnson.com, on the website and on Twitter at Dr. Umar Johnson.